On May 3, 2013, 3 days after he started, 3 days after he started to experience tachycardia. Tachycardia is abnormally fast resting heart rate. According to Mayo Clinic by Dr. Laskowski, a normal resting heart rate for adult ranges from 60 to 100 beats per minute, but Halim's heartbeat rate went up to 140. So once again, I had to take him to the emergency room where he had to stay overnight to monitor his heart. So this is the diagnosis here: anemia, tachycardia, colon mass, and colon cancer. Halim, would you like to share your symptoms of tachycardia?
Well, yeah, I was very scared. Maybe I have to stand there.
Whatever you feel comfortable with.
I was very scared. This is the first time happening after the surgery. The doctor was there. It's like I can't go up to 120. And I was taking like medicine from Dr. Bashir, my family doctor. And he said stop this medicine because it's going to be this drop. So I did. So like long time, like 7 years ago. So now more 140. I feel like very scary. If somebody push me like this, it's gonna be very scary. I can't eat, I can't walk. I mean, very, very scary. So
Okay, thank you.
yeah.
So echocardiogram and stress test got done. And another blood test got done as well, showing persisting anemia. So before talking about the anemia again, we checked his heart test with his cardiologist. No cardio issues have been found. The whole focus was on tumor removal while disregarding tachycardia symptoms. As a wife, I wanted to make sure that his heart condition would allow him to pass the surgery without any further complications, either during or after the surgery. And from a holistic perspective, I must discover the cause or the underlying cause of this tachycardia, address it and correct it, again, to prevent any further intricacy. So this is the second blood test. Red blood count marked low for hemoglobin, low 23.5, hematocrit low 34.4. So, why do I have to correct the tachycardia underlying causes? Here's the strange part. If you look under tachycardia, when you search under tachycardia, you can find nothing. But when you look under anemia, you can. So, according to Cleveland Clinic, while the more typical chronic development of anemia, the clinical changes are subtler and depend on the patient's age and comorbid conditions. The most familiar of these changes is an increase in cardiac output causing symptoms of palpitation and tachycardia, breathlessness, especially on exertion, and dizziness and lightheadedness. So this was the case with Halim. As a holistic practitioner, I tailored high iron food content diet, along a therapeutic supplement protocol to correct his anemia problem. So the second day, tachycardia disappeared. I want you to benefit from this part. Can you give me any type of food that is high in iron content?
Steaks.
Liver.
Spinach,
Liver.
liver.
Organ meats are
Right. Right.
Spring,
What about kale?
Cast iron enamel. Like
Yes,
cast iron.
right.
lamb spring.
Yes. So we didn't give him any tablets because the tablets would make him constipated, which make his case worse. So I had to tailor a diet for him. Like he used to eat liver at lunch and at dinner, plus the spinach, plus the lentil soup, you name it.
Right.
So in 2 days,
Right.
the tachycardia disappeared. Well, that was good. Before going under the knife, what would you do before going under the knife? When one doctor would say, right, but when one doctor would say, okay, this is your last option, go, you have to have surgery. Don't you want to consider a second opinion? So that's what we did. So we wanted to have a second opinion in case we can avoid operation by doing some type of possible therapy to shrink that tumor. Because waiting longer might have negative consequences, which colon blockage may occur. So additionally, the surgeon was planning to go on vacation, so it's time to make a decision. So on May 8, 2013, I had a conference call with a couple of holistic practitioner colleagues to discuss his case. The outcome came out, a referral to Dr. S in Walnut Creek. So on May 14, 2013, that's the day, we went to Walnut Creek to see Dr. S, and his recommendation was also remove that mass from the colon. You must have surgery. So furthermore, he required further blood test markers to track cancer cells before and after the surgery. Well, last and only option was surgery. That's it. Before going to the surgery, I would like to share with you the physician impression scan. Here's what he said here. Prior, I barely can see too.
Plan.
Prior to surgery, plan have been discussed with the patient as well as the possible treatment of chemotherapy after the surgery. I wanted to show you this part. So the doctor had to discuss this option with Halim before the surgery to prepare him. The operation day, that's the date, 5/21/2013. The procedure, robotic simple resection. The history of present illness. He said his age was a newly diagnosed signal colon cancer. Halim stayed in the hospital for 2 days. I monitored every single pill that was given to him. The second day, the nurse came in with a shot. I said, excuse me, wait, what is this for? She said, this is anti-acid shot. I said, what is it for? She said, well, he might have acidity. I said, he doesn't have acidity. I don't want you to give him this shot. And I said, do you know normally we need acidity in the stomach to digest our food? Please, I don't want you to give him this shot. I said, okay. Anyway, I was monitoring every single pill he was taking. So he ate very lightly from meals served at the hospital while I mostly cooked for him every day. And from the second day, I was giving him a very essential food, especially to build his immunity. Why? Because in this case, where does the immunity exist majorly? Where? In the gut. In the gut. When we say immunity, we are talking about the good flora, the good bacteria. So in this case, Halim's intestines were just like baby's intestines, have zero good bacteria. So since the second day, I started to give him this essential food to boost his immunity. Anyway, so he was on baby diet for 1 week. Everything should be watery, all liquid. And then, like the next week, a little bit of mushy food, and then slowly and gradually to go back to his normal diet. After the surgery, there is a very important test. Any clue? Every surgeon would do it.
Blood count for infection?
No, especially with cancer type. What do we call this test? The pathology test, right?
Oh, yeah.
The pathology
From what
test.
they took.
Yes.
Yes.
So waiting for that test patiently, right?
Yes.
Here's the result. Lymph nodes, metastatic carcinoma identified in 10 of 20 lymph nodes. 10 positive, 20 total. Tumor deposit present. So that was scary enough that even we removed that colon mass and cancer deposits were still present. At his post-surgery follow-up with the surgeon, of course to check his incision, on May 28, 2013, he referred him to an oncologist, right? Which is obvious. That time, I had a conversation with him, sharing a fact, very important fact about chemo option. And this fact is adapted from Dr. Lux. I will tell you in a minute who is Dr. Lux. So Dr. Lux said, chemo can cause a lot of collateral damage, which creates difficult side effects and leaves the body even less able to fight the good fight than it was when the cancer first started. And because chemotherapy attacks cancer cells while they are reproducing, this sets the stage for mutation and faster development of new cancer cells that won't respond to the next round of chemo. So this is why it becomes back after treatment more aggressive than ever before. And this is true. What was the doctor reply? That was his reply. This is the only common and recommended method to treat cancer conventionally. We have no other option. Now, it's the time for Halim to make a serious, conscious decision. So I presented an educational opportunity for him, explaining conventional therapy chemo versus the holistic natural therapy. So he would be able to make an informed decision. After 3 days, he chose to pursue the natural solution, asking my professional assistant. Halim, would you like to share why you didn't want to do chemo?
Yeah, because I know everything from her. And she shared everything with me before the surgery. When we start after her license, and she started with the client, right? Everything she said in the computer. Come on, sit down here. She showed me everything. Now she showed me how is the therapy. Chemotherapy affect your guys in court and then she has like a supplement and I was using it like 7 years ago like that. And we spend like $700 me and her just for supper. I was taking every day breakfast, lunch and dinner. And I'm so surprised why I just
Would you like to tell a little bit about your friends who went under chemotherapy?
Yeah, actually, my friends. I have two friends. They are Lebanese both of them. his surgery, heart surgery, and he had cancer too. And we asked him to help him for free. And the other one too, he's working with the city, so the city. She sent him every information, nothing, we don't need money, because you are like from my country, and you know. He said, give me time to think about it. So we gave him like a couple of days. He called me, he said, thank you very much, not for the money, I decided to quit. 2 weeks, but
He passed away. Okay, thank you, sweetie. Yeah, his case was really complicated.
But he doesn't have, like me, everything is clean. So the cancer all the way.
It was spread out
Even
everywhere. It
for
was
the
too late.
liver.
Yeah, it was too late. Okay, thank you, Habibi. Back to this very important question for me and for Habibi. Why and how it did happen. As a wife, I wanted to do my best